nurses are burning out, they're exhausted and they're stressed.
Saskatchewan nurses are on edge as the province veers toward yet another wave of the COVID-19 pandemic. They fear the healthcare system isn't prepared for what might lie ahead. One of the main issues, staffing shortages. The Saskatchewan Union of Nurses, or SUN, says more than 80% of its members reported vacancies in their units this past spring.
And people, like the numbers say, aren't willing to work like that anymore. They don't want to sustain that. They can't sustain it.
The Saskatchewan Health Authority has confirmed some healthcare workers have left the province and even the field altogether over the last 2 years. The SHA wouldn't provide specific figures, but says solutions are being looked at to address the issue.
That's part of our overall HR strategy to identify how can we retain the employees that we have to create a good, positive working environment, but also look at recruitment opportunities, whether that's internationally or promoting locally.
In the short term, the health authority says that it will continue to monitor staff absenteeism. If facilities or units don't have enough workers to keep running, that could mean service disruptions, something that we have seen more frequently throughout the pandemic. Meanwhile, the latest data obtained by CBC News shows COVID-related hospitalizations are also creeping up. This after being on a slow decline since mid-April. But as of July 22nd, 147 people were in hospital with the virus. That's a 24% increase from the beginning of the month, and a familiar sign that the end of this pandemic is not yet in sight. Alexander Kwan, CBC News, Regina.